One of our conclusions was to promote the guidelines of the alternative care of children. And I now want to promote our template, quality care counts, the implementation of international quality standards. I think this is one conclusion we have of all these facts and figures we have seen. And we have to advocate for necessary reforms. We have to have a close look on the real situation, and then we can react. And we have maybe to look again and again on the situation, then we see it better and better. We have some tools with which we are looking or watching the situation in a country. The first is the child rights situation analysis. To get a close picture, where are the vulnerable children in this country? And then we go into this location and do a feasibility study. The feasibility study means we talk to the duty bureaus, to the people of the community, to stakeholders, to the people, to children, and get a closed overview what is really going on in this location. We have a focus on child development, and we do hopefully all in the best interest of the child and children involved in finding solutions. We do this child development through family strengthening. We strengthen the families of origin, foster families and SOS families. And also we support the community. We do this with direct essential services like care, education and health. We do this through capacity building of the people in the community, in the direction to become a child-competent community. And we do this also to advocacy on the local level and also in the country level. So these are the very simple things we are doing. In the practices, we are more complicated, but I'm a theoretical thinker, so I have to put it in a theoretical frame. The precondition for SOS Children Villages to enter a location is that the direct essential services we offer are needed there. This is deinstitutionalization, but I think it may be in a little bit a different sense. In a more global sense, each individual service provider should be interested in reflecting and identifying possible features of institutionalization. In the guidelines you see a lot of comments and paragraphs about monitoring and evaluation. And I think it's really necessary because you have to look, if a child is in alternative care, you have to look at it. Because this alternative care has to be better than the care in the family before. But if you monitor systems, you will see that maybe the people working in the families need assistance, need support, need counseling. So you will create up a professional network for counseling, supporting. The next conference may be in 5 years about the topic, how can we reduce the influence of monitoring? And the last topic is co-creation. We have to co-create together new things beyond all what we are doing now. But I think in 5 years we have to go beyond this. We have to co-create new things together, beyond what we are doing or the other organization is doing.